Good afternoon. I call this meeting to order and ask that you rise for a moment of silence and the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Alexis, would you please call the roll?
Mrs. Reed?
Here.
Connor?
Here.
Mrs. Rua?
Here.
Mr. Minio?
Here.
Mrs. Doobie?
Here.
Mr. Bonavita?
Here.
And Mayor Satelli?
Here.
7 present.
Thank you. Next, we have citizen speak time. As we all know, due to the fact that we're remote, the only way we can accommodate citizens at this particular time is to have them submit emails, which we will read aloud. So Alexis, would you please read the citizens' comments?
And while Alexis is reading, if you guys could mute while she's reading them, that will prevent any feedback. Thank you.
Okay, the first one is from Antonia Moore, who is a teacher at the Agawam Junior High School. As Mrs. Rua pointed out at the last workshop meeting, not one district out of 275 has come out in favor of immediately returning to full in-person learning this fall. That should tell us something about the desire of other towns in Massachusetts to manage school reopenings as cautiously and responsibly so as to protect the health of students and staff and prevent a further resurgence. We all know children can get this virus, and more importantly, they can transmit it just like adults. There's a big difference between 3 and 6 feet in terms of safety, and there's an even bigger difference between giving voters what they want and putting the health of students and teachers at risk. There is a way to open Agawam schools responsibly while giving students the education they deserve. I urge the school committee to do the responsible thing and take the incremental approach. This may be the most important vote you'll ever cast on this committee. Make it a vote for putting the safety of our community first. Thank you. The second message was from Connor Kelly. At Bay State Hospital this past July, one single person ignored quarantine procedure, and 23 people wound up infected with COVID-19. This was a trained medical professional. If you can't even trust the most highly qualified adults to follow proper safety protocol during this pandemic, how can we possibly depend on a building full of children to do so? Have you ever tried forcing a child to wear something they don't want to wear? Have you ever seen how thoroughly a child washes their hands? Depending on students to comply with social distancing and mask regulations is extraordinarily dangerous. Reopening schools is not just endangering staff and students if a child brings the virus home. Their parents will be exposing their coworkers, grocery store workers, gas station workers, family, and putting an additional burden on already exhausted healthcare workers. Essential does not mean expendable. It means the opposite. Educational setbacks are uncomfortable, but not permanent. Death is. Vote to implement remote learning. Our next message is from Deanna Moore. Nationwide, the schools that have already begun in-person classes are reporting infection after infection in both students and staff. Agawam was recently targeted for COVID-19 testing because Governor Baker named 8 communities where infection rates far exceeded the state average. Out of 351 cities in Massachusetts, Agawam was in the top 8 coronavirus hotspots. During the July 30th open conference call with the school committee, an Agawam resident freely admitted to letting his son run around without a mask, and come into direct contact with other people who don't live with them. This was one of the parents pushing for in-person learning. Those who want to get back in school the most are the ones being the least careful. Children often don't display symptoms, but they can still transmit the virus, and he could easily be one of them. In-person learning will not be what it used to be. Neither students' academic nor their social emotional needs can be met in an environment with social distancing, masks, extended class periods, highly regulated movement, and fear of infection. Please vote for remote learning. We can make it work, not hybrid, and absolutely not full in person. Mistakes can cost lives in this situation. The next message is from Mr. Paul Ryan of South Street, Nagwam. It is with a heavy heart as a teacher, parent, and community member that I am writing to support that our schools start remotely, followed by a phased-in hybrid model, followed by full in-person, upon conditions nationally improving or a vaccine or other measures created. Until we have good data on indoor close contact transmission from young children, it appears that remote learning is the safest option for our students, teachers, and community members at large. No matter what your choice, I will continue to faithfully serve our community and educate our children. Respectfully yours in education, Paul Sawyer. Next, we have a message from Elizabeth Mortensen of Agawam, who's also a teacher. I am writing to you as a citizen and a teacher of Agawam to request that you vote for a remote start for this school year. I have worked as an educator in my hometown of Agawam for 10 years, and I cannot wait to get back to my classroom. Unfortunately, it is just not safe or healthy for our kids to do so in September. Elementary-aged children are energetic, impulsive, tactile, and constantly seeking out the comfort of others. They learn best when they can be hands-on and collaborate with peers. The environment that would be enforced in September would simply prevent children from acting like children. The committee is currently considering allowing older students to return to a hybrid model, while forcing K-4 students and teachers to return full-time to their buildings. I cannot emphasize enough how damaging it would be to our children if all their natural impulses to play, socialize, touch, and bond would be stifled to such a detrimental degree. Additionally, teachers would be forced to return to outdated methods of teaching that have been proven to be ineffective. What this comes down to is what this committee now believes is a justifiable risk for teachers. Every teacher in this district has risked many things to be a teacher. We have risked financial security to pay for the graduate degrees that were necessary to keep our licenses. We have risked not being able to save money or pay bills when we bought books, furniture, cleaning supplies, and more to create the best environment for our students. We have risked our emotional health during active shooter drills when we had guns pointed in our faces and were forced to listen to gunshots so we could recognize the smell of gunpowder. We have taken these risks willingly because each of us believe wholeheartedly in supporting Agawam's children develop into productive and empathetic citizens. However, what you are asking is no longer a risk to be just ourselves. You are also asking us to risk our parents' health, our family's health. The decision how and when we fully return to school cannot and should not be based on what just parents or teachers want, nor on which side is the loudest. It should be a decision rooted in science, data, and a strong desire to keep our community safe. Any other reason used to justify reopening schools demonstrates nothing more than a reckless disregard for our students and teachers. Agawam still has time to learn from the mistake of others. Learn from the school in Indiana, which had to isolate and quarantine students for 14 days, just hours into their first day back. Learn from the summer camp, from which nearly 300 counselors and campers tested positive for the virus. Learn from Bay State Hospital, which despite taking temperatures and following other safety protocols, saw 23 employees and 13 patients contract COVID from a maskless lunchroom. Learn from the school in Arizona where 3 teachers who shared a classroom contracted COVID, resulting in the death of one of those teachers 2 weeks later. Agawam has a chance to be part of the solution like many districts in Massachusetts, which have already chosen to begin the year remotely with the full support of parents and teachers. It is the only option which keeps our children and teachers safe. And our last message is from Maria Petronero, who is a teacher at Robinson Park School. To the members of the school committee, I'm writing to you as a resident as well as a teacher in Agawam. I have taught proudly and with passion for what will be 12 years this September, 1 year in kindergarten, 11 as a special educator. Prior to this, I was a paraprofessional for 4 years. The energy, engagement, and excitement of the classroom and the students I teach cannot be matched in any other profession. As a special education teacher, I provide specially designed instruction to help students equitable access to the curriculum as non-disabled peers. I passionately advocate for my students' right to faith in the least restrictive environment possible. However, one day of teaching, I have always known what my number one job was. My number one job is to keep children safe. I have participated in active shooter drills and had a gun pointed in my face because I purposely placed myself in front of students to protect and block them. To this end, my colleagues and my own emotional well-being was put at risk. My physical well-being was as well because of residue in the air that affected my eyes for hours afterwards. My number one job is to keep children safe. Having been trained in CPI and now safety care, I have learned and utilized methods of de-escalation to safely diffuse otherwise volatile situations. I have comforted students whose underlying trauma was too much to bear. My number one job is to keep children safe. I am concerned that what may be asked of me and my colleagues will make it impossible to do my number one job, to be a classroom full-time with the restrictions described by DESE, and our district will threaten to bring back archaic teaching methods that are not appropriate to many students. More importantly, these potential on-site scenarios only give the illusion of safety in a perfect environment. Children by nature are inquisitive, social, and of course, impulsive. I do not think for a moment that they would follow these very strict rules we are to impose on them, not because they are naughty, but because they are children. My number one job is to keep children safe. But what about my family? Being in school full-time will effectively limit my interactions with family members, my adult children, and especially those people in my life who rely on my husband and myself for extra support, care, and time. Every interaction with them will be fraught with worry and fear. I ask you to make your decision to please consider the safety and well-being of those who I am entrusted to keep safe, both my students and the heart of my life, my family. Respectfully, Maria Petronero. That's the final message, Mayor.
Thank you, Alexis. Under highlights on education, we have none this afternoon. Next, we have superintendent's notes. Interim Superintendent Hoffman.
Thank you. Recently, the Commissioner of Education, Jeff Riley, and the MTA signed a memorandum of agreement in which the 180-day school year could be reduced to 170 days to allow up to 10 more planning days for teachers to learn the new procedures and policies, get additional training, and even possibly meet students in small groups before the first official day of school. This would move the first day of school to no later than September 16th. This will be something we will need to impact bargaining with the Agawam Education Association. The school committee voted on June 9th to add one additional day for teachers prior to the start date of September 3rd. Additional upfront planning days for teachers before the start of the school year would potentially set the first day of school in Agawam for September 16th. The final reopening plan, which includes 3 different models of reopening, must be voted on by the school committee and submitted to the Department of Secondary and Elementary Education by August 10th, with a decision as to what model we will plan to start the 2020-2021 school year in Agawam. I will be presenting this plan this evening under reports. Thank you.
Thank you. Under unfinished business, we have none this afternoon. Under business meeting, is there a motion to approve the June 23rd regular meeting and July 28th workshop minutes?
So moved.
Motion made by Mr. Minio, seconded by Ms. O'Connor. Questions or discussion? Alexis, call the roll, please.
Mrs. Reed?
Yes.
Mrs. O'Connor?
Yes.
Mrs. Brewer?
Yes.
Mr. Minio?
Yes.
Mrs. Juby?
Yes.
Mr. Bonavita?
Yes.
And Mayor Sapelli?
Yes.
7 yes.
Thank you. You approved the minutes from our June 23rd regular meeting and our July 28th workshop. Next, we have calendar and correspondence. Mrs. Reed, do we have anything this afternoon?
Not tonight, thank you.
Thank you. I now will read the warrants and entertain a motion to approve them as read. All of the warrants have been signed. And please bear with me, there are several of them because we meet so infrequently in the summer. First, we have SW 20-112, warrant number 20-425, amount of warrant $101,936.27. SW 20-114, warrant number 20-431, amount of warrant $101,589.03. SW 20-115, warrant number 20-438, amount of warrant $5,155. SW 20-116, warrant number 20-439, amount of warrant $5,325. SW 20-117, warrant number 20-440, amount of warrant $59,373.17. SW 20-118, warrant number 20-444, amount of warrant $4,938.42. SW 20-119, warrant number 20-451, amount of warrant $69,555.11. SW 20-120, warrant number 20-452, amount of warrant $346,069.24. SW 21-1, warrant number 21-006, amount of warrant $131,182.40. SW 21-2, warrant number 21-014, amount of warrant $6,471. SW 21-3, amount of warrant 21-015, amount of warrant $8,269.23. Those were the regular warrants. Now we have the payroll warrants. Payroll warrant 20-06. Payroll date, June 2020. Amount of payroll, $3,114,497.68. Warrant PW 20-07. Payroll date, June 2020. It's a lump sum payroll. Amount of payroll is $754,931.88. Warrant PW 20-8. Payroll date, July 2020 payroll, amount of payroll, $2,397,412.33. Warrant PW 20-09, payroll date, July 2020 payroll, amount of payroll, $236,067.26. Warrant PW 20-10, payroll date, August 2020 payroll, amount of payroll, $2,194,527.74. Is there a motion to approve the warrants as read?
So moved.
So moved.
Motion made by Mrs. Reed. Is there a second?
Mr. Bonavita.
Mr. Bonavita, thank you. A second by Mr. Bonavita. Questions or concerns? Alexis, would you please call the roll?
Mrs. Reed?
Yes.
Mrs. O'Connor?
Yes.
Mrs. Rua?
Yes.
Mr. Minio?
Yes.
Ms. Doobie?
Yes.
Mr. Bonavita?
Yes.
And Mayor Sapelli?
Yes.
It's unanimous, 7 yes.
Thank you. With a vote of 7 yes, you've approved the warrants as read. Next, under reports, we have the reopening of school report with Interim Superintendent Hoffman.
Thank you. This document that I'm about to outline for you is, again, one plan that is composed of 3 different models that is to be submitted and ask for your approval tonight, with the realization that at any time we might have to change from one of the models in the plan to another throughout the school year. This document provides a detailed framework of the Agawam Public Schools plan and preparations for reopening schools in the fall of 2020. Based on lessons learned from the spring 2020, review of state guidance, and reflection on stakeholder input, Agawam Public Schools has developed a reopening plan that consists of 3 models: full in-person, with precautions, hybrid, and fully remote. Our guiding principles are creating safe learning and working environments for students and staff, providing all students instruction that meets state standards and has the necessary supports needed for success, providing training, time, and anything else necessary for staff to prepare for successful opening, providing timely, consistent communication to all families and staff. The first model in our plan is the full in-person learning with new safety requirements. This plan for Agawam would have an in-person return to school 5 days a week for all students. In order to accommodate all students, classrooms and buildings can provide a minimum of 3 feet of distancing, but not 6 feet of distancing. Desks would have to face in one direction, with 6 feet of instructor space in the front or the side of the classroom. In order for this plan to be implemented, we would have to use alternative school spaces such as libraries, cafeterias, auditoriums, other available spaces to set up additional classrooms to accommodate more students and by reducing the class size, and enable additional distancing while adhering to the health and safety guidelines. Teachers may also hold outdoor classes if the weather is appropriate. This model would also, in order to accommodate times of the day where there's large traffic flow, this model would need staggered arrival and dismissal times. In addition, additional lunch times and locations would have to be used. Mass breaks would have to be scheduled throughout the day for students and staff, since they would be unable to be taken in the classroom with less than 6 feet distancing. When in the classroom, all students have assigned seating. Students will be restricted to their grade level class to the greatest extent possible, and high school students would have a modified schedule so that only 4 classes meet each day with reduced class sizes. Schools would group students into clusters to try to reduce interaction with other groups of students to the greatest extent possible in this full in-person model. The second model of our plan is a hybrid learning model. We have developed 2 distinct groups or cohorts of students who would attend school in person on different days of the week. Our hybrid in-person schedule would consist of Group A, with the last names beginning of letters A through K, to attend school on Mondays and Tuesdays. Group B would consist of students with the last name beginning with letters L through Z and would attend school in person on Thursdays and Fridays. Students who share the same household will be able to attend school on the same days. All students will participate in learning remotely on Wednesdays. Our hybrid remote schedule. So that was for when students are in building with their cohort, when they are home and outside of the buildings. On these days, when there's remote instruction, the classroom teacher is working with the in-person students at school. Students at home will participate in asynchronized learning. Asynchronized learning occurs when students are not online at the same time to complete work. Teachers may provide video lessons or guided independent work to students on those remote learning days. Every Wednesday, all students would participate in the hybrid model, would participate in synchronous live sessions with their teachers. Daily attendance will be taken whether a student is in person or remote, and it is mandatory on all days. Student expectations on remote Wednesdays would be attend daily live class sessions, have sound and video available to ensure engagement, comply with the expectations outlined in the handbook for behavior during group instruction, be present and attentive during class sessions, and complete and turn in assignments directed by teachers. Grading. All students will be graded according to the established grading policies. All assignments will be assessed and included in a student's grade. Learning. The hybrid model is based on a blended learning approach where instruction is provided in both in-person and online. Blended learning is student-centered and conducive to encouraging collaboration, problem solving, and communication skills both in groups and individually. At the elementary level, cohorts of teachers and paraprofessionals have been established. Educators would work collaboratively as a team to provide skill-based direct instruction and supervision to the in-person cohort while also monitoring the work of remote students. At the secondary level, a modified schedule with 75 minutes of class time daily with approximately 10 students in person will allow for teachers to design their instructional blocks to be student-centered also. This will allow teachers to develop multiple doses of content-rich direct instruction to students in person while still having time to address the work of remote learners. Special education in this hybrid model. The Department of Special Services will continue to work with the state and the local staff to deliver services to students with disabilities. Students with disabilities that require more intense services will be prioritized for in-person learning 4 days a week. Related service providers will deliver services to the best of their ability, both in person and remotely. All special education students will have a liaison who will facilitate communication with families. Co-teachers should co-plan once a week for 15 minutes on Wednesdays. Virtual IEP and 504 meetings will be scheduled, and the necessary staff members will be present to participate in these meetings to meet the special education guidelines and requirements. For English language learners, Agawam EL teachers will continue to have contact and service with their EL students in this hybrid model. EL students who have disabilities will be prioritized for in-person learning during the hybrid model. Agawam Schools has also purchased a new system that allows for enhanced communication in multiple languages. Agawam's learning management system platform is Google Classroom. This will enable self-directed study and allow teachers to assign and receive work, track progress, and provide targeted feedback and support in both the in-person and remote situations. We also have collaboration tools to facilitate some of that online work, all through Google. Google Docs, Google Chat, Google Drive, Google Calendars, Google Forms. In addition to Google Classroom products, our district will be purchasing more tools to enhance instruction, assessment, and learning. These tools are Nearpod, Screencastify, Star 360, Freckle ELA, Freckle Math, Accelerated Reader, Grade Slam Paper, Education, BrainPop, RazKids, PebbleGo, ESGI, and FitnessGram. In addition, Agawam has purchased a platform called Clever that provides a single sign-in access point for students and families to make accessing remote learning as simple as possible. This will eliminate the multiple usernames and passwords. All of the above mentioned instructional tools and software will significantly enhance our remote teaching abilities. Our third model is the remote learning plan. Agawam's remote learning plan will be available for individual students who cannot yet return in person and for all students in the event of classroom or school closures due to COVID-19. The remote learning plan will look slightly different in those two situations just described. Again, attendance will be taken every day and participation is mandatory. Our remote learning plan will include regular two-way communication between students, educators, and families to ensure students and families have meaningful opportunities to connect regularly. With staff, students will have regular consistent opportunities to access live lessons, synchronous instruction, student-to-student interaction, collaborative assignments, projects, teacher feedback, and other needed support. Attending the live lessons with our staff is a requirement for all students when they are remote learning. And as in our hybrid model, our student expectations for remote only are the same. And grading, again, will be determined by the established grading policies, and all assignments will be graded and accounted in a student's grade. Special education in remote settings, related service providers will deliver services to the best of their ability. The Department of Special Services will continue to work with the state and the related services providers to determine if students with disabilities that require more intense services could receive in-person schooling and services even in the remote model. All special education students have a liaison. Again, that contact is with special education students will be attempted 1 to 3 times per week in the remote model. A communication log will be shared with the special education director and supervisor. Special education teachers will modify work as needed. And again, our EL learners, when our EL students are learning remote, our AGWOM teachers will continue to have contact and service our EL students. As in the hybrid plan I just spoke to, we will all use the tools, the software, et cetera, previously mentioned in the hybrid plan will also be used in the remote plan. Some critical health and safety requirements that are included in our plan. Medical waiting room. This is a separate space from the nurse's office or the regular space for providing medical care. That will be an additional room in each building. The medical waiting room will be used when a student or staff member presenting COVID-19 symptoms need to be separated. AGWOM is looking to hire additional nursing staff for these medical waiting rooms. Masks. Masks are one of the most important tools to prevent transmission of COVID-19. Students in grade 2 and above are required to wear a mask that covers their nose and mouth while on school grounds, school buses, and at school events. Exceptions for meals and mask breaks and medical exemptions will be permitted. Students in pre-K, kindergarten, and grade 1 are strongly encouraged to wear a mask. Adults, including educators and staff, are required to wear a mask while on school grounds and at school events. Exceptions for meals and mask breaks and medical exemptions will also be permitted. Exceptions to masks requirements will be made for those who it's not possible due to medical conditions, disability impact, or other health or safety factors. If a medical exception is being used, appropriate medical documentation may be required. Mask breaks will occur throughout the day when students can be 6 feet apart and ideally outside or at least with windows open. Masks should be provided by the student and family, but extra disposable masks will be made available by the school for students who need them. Reusable masks provided by families should be washed by families daily. Students should bring a spare mask to school each day. Students should make sure their masks comply with the school dress code. Masks are required to be worn by everybody on the bus. Mask policy. AGWOM Public Schools will be following the mask requirements set forth by the Massachusetts Department of Elementary and Secondary Education, stated above. Refusal to wear a face covering or mask correctly for non-medical reasons will result in disciplinary action in accordance with the student handbook or progressive discipline in the case of staff, as well as removal from the classroom. Physical distancing. Physical distancing is another important practice that helps mitigate transmission of the virus. AGWOM schools will aim for a physical distance of 6 feet when feasible and a minimum of 3 feet at all times. Classrooms and facility configurations, to the extent possible, desks will be spaced 6 feet apart, but no fewer than 3 and facing the same direction. And of course, depending on which model is chosen will depend on the distance. Additional safety precautions are required for school nurses and certain staff, and we will make sure that we have that proper equipment available for them. Hand washing and hand sanitizing stations. They will be provided in the following common areas, and we will ensure that there is enough supplies at all times to accommodate frequent hand washing and sanitizing. All entries and exits in bathrooms and classrooms, in shared activity spaces, next to meal distribution and consumption areas, and next to mask break areas. School cleaning and disinfecting. AGWOM Schools has updated its cleaning and disinfecting protocols, obtaining additional supplies, and trained staff appropriately. Cleaning and disinfecting will occur for shared spaces and furniture, for high-touch surfaces like door handles, light switches, handrails. Cleaning and disinfecting will occur multiple times per day between uses. Desks will be cleaned at least daily. Ventilation. The AGWOM Maintenance Department has inspected and serviced all school ventilation systems. All air filters have been replaced. It is also recommended for classroom windows to be opened during school hours for increased air circulation. For any spaces without windows that may be used for student activities, special attention has been given to ensure that there are adequate HVAC capabilities for that space. All of our school buildings currently have univent systems in all of our classrooms. These systems draw in fresh air from the outside through filters and out through the rooftop exhaust fans, making continuous airflow. Administration has developed movement protocols to avoid crowding and maintaining cohorts as best as possible and minimizing interactions. This will include plans for arrival and dismissal times, transitions between classes, and bathroom breaks, as well as outlining one-way movement pathways for hallways and cafeterias as needed. Agawam schools will ensure clear and age-appropriate signage is posted in highly visible locations throughout the school property, reminding students and staff to follow proper health and safety protocols. Food service operations, eating areas for students, as students will be unmasked to eat. There's a strict requirement of 6 feet of physical distance between each student. Based on current CDC recommendations, it's preferable that students eat in the classroom spaces. Meals for remote learners. Agawam schools will continue to offer meals for eligible students who are learning remotely from home. We will operate lunch and breakfast programs as applicable for students who will not be attending in-person school 5 days a week. Visitors and volunteers will have to be reduced. No outside visitors and volunteers are recommended except the contractual service providers for the purpose of special education, required support services, or program monitoring as authorized by the school or district. A staff member in each school will be assigned to enforce this protocol. We will have single entry and exit points. We will track visitor log. We will keep a track of visitors with a log, and we will minimize parent-family visits as appropriate. Transportation and busing. Agawam schools are asking families who are able to transport their children to and from school to assist in creating more room on buses as we adhere to the state's transportation guidelines. On buses, masks must be worn by all staff and student regardless of age. Distance. Students should be seated no more than 1 student per bench, alternating sides for each row. Ventilation, keeping windows open at all times during operation unless not possible due to extreme weather conditions. Routine cleaning and disinfecting. Buses will be cleaned multiple times daily, including between each bus route. And seat assignment, students will be assigned to a single bus seat, and family members, I believe, are able to sit together. That is the conclusion of my report.
Thank you, Sheila. This is Wendy. I'm sorry, I just want to let people know that we lost power here. So I heard parts of that and managed to log back in, but if that happens again, we did lose power, so sorry.
Thank you very much. Hopefully that won't happen again. Thank you, Interim Superintendent, for your detailed report on those issues. Next, we have any subcommittee updates. Is there any subcommittee wishing to update? Seeing none. Under new business, since this issue that we're going to be voting on is coming up as new business, and to get it voted on in the same meeting, we have to suspend the rules. So therefore, under new business, is there a motion to suspend the rules to take action on SCR 20-17, approval of plan for reopening schools in September 2020?
So moved.
Motion made by Mr. Minio, seconded by
Mr. O'Connor. Yeah, go ahead. Mr. O'Connor's fine.
We have a motion and a second. Any questions or discussion? Alexis, would you call the roll?
Mrs. O'Connor?
Yes.
Mrs. Lewis?
Yes.
Mr. Minio?
Yes.
Ms. Doobie?
Yes.
Mr. Bonavita?
Yes.
And Mayor Sapelli?
Yes.
7 yes.
Thank you. With 7 yes, you have approved us to going to vote on this tonight in one meeting and to take action this evening. Next, I need to let you know that there's going to be two votes here. First, we're going to vote on the plan to submit 3 of these different models. We have the total remote, we have the hybrid, and we have the all-in. The first vote we're going to take is on that plan to submit all 3. After that, we are going to have a vote on which of those 3 we want to put forward. So I suspect that'll be the vote that'll have the most detailed discussion and in-depth conversation. So once again, is there a motion to approve SCR 20-17?
So moved.
Second.
Carrie.
Ms. O'Connor, seconded by Mrs. Ruoff. Before I go into questions or discussions, I will read that resolution. It includes all 3. Approval of plan for the reopening of school for the 2021 academic year. Whereas the COVID-19 pandemic is a monumental and unprecedented challenge and emerged quickly and demanded an immediate overhaul of the instructional plans and strategies of school systems across the state. And whereas the state's public schools remain committed to delivering high-quality instruction while ensuring the health and safety of all students and staff. And whereas the Massachusetts Department of Elementary and Secondary Education has requested districts across the Commonwealth to submit 3 reopening models to the state for consideration. And whereas this plan shall include an all-in-person model, a hybrid model, and a fully remote model. And whereas the Agawam Public Schools has welcomed input regarding the best and safest way to reopen schools from parents, teachers, and community at large through several surveys. And whereas the Agawam School Committee has met to review and discuss the 3 options for reopening schools. And whereas the Superintendent of Schools, Assistant Superintendent for Curriculum and Instruction, and the entire administrative team has brought forth the best options for reopening schools. And whereas this plan includes all safety protocols and standards set forth by the Massachusetts Department of Public Health and the Center for Disease Control. And whereas current data research indicates that students need to be in school and are less vulnerable to COVID-19. And whereas the state and the CARES Act have provided funding for the purchase of personal protective equipment for schools and staff that will help prevent the spread of COVID-19 in schools. And whereas the majority of parents surveyed want their children to return to school in some form, and whereas research has repeatedly found that social and emotional issues become more prevalent when children are not in school, and whereas for students to thrive and realize a bright and productive future, the district has put forth a plan that is first and foremost in the best interest of students. Now, therefore, be it resolved that the Agawam School Committee joins with the Superintendent of Schools in submitting the Massachusetts Department of Elementary and Secondary Education a plan that addresses the educational needs of students while also providing a safe and healthy learning environment for the entire Agawam public school community. So, questions or discussions?
Mr. Bonavita?
Yes, Mr. Bonavita.
I'm sorry, I didn't mean to cut you off on that.
I did, and I was done.
Okay. When our interim superintendent referred to the remote model, she had some caveats attached to it, I thought I heard.
All right, let me interrupt you for a minute, Mr. Bonavita. Right now, what we're voting on is to submit a plan that presents those 3 models to the state, period.
I understand.
Once we approve that, we are going to discuss in detail each one of those models independently of each other.
Well, I understand that, but I don't want to vote on submitting these 3 models if I don't understand what one of the models, what the criteria is for one of the models. The remote model, I heard something, there were some caveats to it, and I want to make sure I have it straight before I vote to send this entire plan. If she could explain, we can vote, the remote model means all remote for whatever period of time we determine.
Yes, I would say yes.
And there's no conditions on it. It only can be used, certain situations. It can be used, wherever the school committee deems fit.
if you're suggesting, Mr. Bonavita, that if we have to pivot either backwards to a remote plan, the answer to that question, I believe, is yes. In other words, if we get to a point in the year where we've moved, let's say, to a hybrid, and we decide, hey, based on recent developments and information and data, that this is not a good situation, as a school committee, we can take a vote to go back, pivot back to remote. Is that your question?
Well, actually, I was looking at it the other way. If we go all remote, I'm just considering all options here. If we go all remote, can we set a time limit on it and then say after a certain period of time, we want to go to 50-50 or hybrid?
I believe the answer to that question is yes, we can pivot forward when necessary or backwards.
Okay, thank you. You've answered my question. Thank you.
You are welcome. Any more questions or comments with regard to approving the plan to submit these 3 models to the state?
I do. So I think I'm understanding Mr. Bonavita's question, so if you can re-clarify one more time, sorry. In the plan being submitted with the 3 models, the remote learning plan states in that first paragraph, it will be available for individual students who cannot yet return in person, and for all students in the event of future classroom or school closures due to COVID-19. Nowhere does it say we can select the remote because it's a district preference. I think that's maybe where the confusion of language is.
That's exactly right. Thank you.
Thank you.
So that option is available to any student that would want to choose remote only, even if the rest of the district is either hybrid or in person.
Otherwise, we can report, as you notice, it doesn't specify in there that you can just pick the hybrid and or the all-in either. So the reason it's specified that is to let people know that if one of the other 2 models is chosen, you can still select the remote model. So it doesn't anywhere say that identify you can pick any one. That's assumed any one of these the school committee can vote on independently as a whole and only that model. But if you don't like the other selection that's not remote, can you choose that? We made to make sure we clarified, yes, you may. Does that answer your question?
I think so. I'm just still, the other ones say, Model 1 says Agawam will plan for. Model 2 says Agawam's hybrid learning model. There's nowhere, I just want to make sure that Agawam has the option, if we discuss and choose, to choose the remote, that it doesn't have to be that you opt in. So we're clear on that, yes?
Correct.
Okay, thank you.
Absolutely. That's the spirit and intent of the state's request, to have 3 separate models that you can choose independently, but have a fallback for those that aren't happy with sending children in. Okay? Any other questions or concerns?
Yes, it's Carrie O'Connor. I actually have the same question Mr. Bonavita and Ms. Rua had, so thank you. You already answered those questions.
Alexis, would you call the roll, please?
Mrs. Reed?
Yes.
Mrs. O'Connor?
Yes.
Mrs. Rua?
Yes.
Mr. Minio?
Yes.
Yes.
Mr. Bonavita?
Yes.
And Mayor Sapelli?
Yes.
7 yes.
Thank you. At 7 yes, you have approved the plan for reopening of schools for the 2021 academic year. Now, we know what the 3 plans are. We've discussed them in detail over the last several months. Many of you have visited schools, you've had listening sessions, you've had emails, conversations, school committee meetings, workshops. We are very, very thankful for the work that Interim Superintendent Hoffman did with regard to getting us a ton of information on the subject matter, and reached out to everyone, including the AEA. The teachers had several conversations and emails, had their own listening session. So I think you were very thorough, and we thank you for that. Now, I will ask our interim superintendent to share her thoughts as to which of these 3 models would best meet the education needs of the students, as well as provide the greatest amount of safety, stability, and emotional well-being for students and staff and parents.
Thank you. After reviewing our district's plan to reopen schools, detailing all 3 models, I will now provide you with my recommendation on how we should return to school this fall. This recommendation is made in collaboration with the administrative team and has the support of the Agawam Education Association. I have read every email sent by parents, teachers, staff, and students. I have met with principals, directors, teachers, parents, and students. I have had in-depth discussions with educators and superintendents throughout the state, and I'm a parent of 2 school-age children. One will be an incoming 7th grader, and another is an incoming senior who plays sports, his fall sport being football. I know firsthand how many parents are feeling right now. I'm also the daughter of 2 retired lifelong educators, and although it's been longer than I like to admit sometimes, I was a classroom teacher. I know how many teachers, including some of my friends, are feeling right now. I gave you some of my personal background to emphasize that I don't take any of this lightly, and my perspective goes beyond my position. With that said, as your interim superintendent now for 35 days, the recommendation on how to reopen schools has to be based on balancing all the information that has been collected and processed over the last few months. A recent survey shows that the majority of Agawam teachers want to teach in person to some degree. It also shows that approximately 78% of the staff are comfortable with students spaced at 6 feet apart in classrooms. Many parents want their students back in school. The social emotional well-being of our staff and students is also a high priority to consider. Students want to be back in school, to see their friends, meet their teachers in person. They want some kind of structure to their day. The hybrid model of our reopening plan can accommodate both staff and students at 6 feet distancing. Combined with hand sanitation and the wearing of masks, I feel this model is the safest way to get some in-person teaching for our students. Included in this recommendation to start in a hybrid model is a phase-in approach. If the first day, and all to be determined, is September 16th, which is a Wednesday, our hybrid model would have all students learning remotely on that day, with the cohort B in grades pre-K through 5 and grade 7 reporting to buildings on September 17th, and then cohort A for those same grade levels on September 21st. What this does is it allows for grades 5 and 7 who will be entering new buildings time by themselves without the other grade level. Grades 6 and 9 through 12 will be starting remotely. On September 24th, the hybrid model would go into effect for grades pre-K through 9, so adding additional grades to the hybrid model a week later. With grades 10 through 12 still remote, and then on October 1st, all grade levels in the hybrid model. Thank you.
Thank you, Interim Superintendent Hoffman. Greatly appreciate your recommendation. At this time, I will entertain a motion to recommend one of the 3 models. Is there
Mr.
a...
Mayor?
Yes.
This is Mr. Bonavita.
Yes, sir.
I move to, prior to entertaining any votes, I move to go into committee of the whole.
We can do that. I do have with us this afternoon our Health Director, Kathleen Power, and our Legal Counsel, Russell Duperay. And when we make a motion and second it, and we go next to comments, questions, concerns, we can pull them into that conversation if that's why you're looking to go into committee as a whole.
Well, I am, but yeah, I'm looking to ask questions before I obviously vote on these, but I have several questions concerning combining some of these options, and I want to make sure what my ability is to do that before I do it.
I second that. Can I second Anthony's motion, please.
So we have a motion on the floor by Mr. Bonavita to go into committee as a whole for discussion purposes, seconded by Mrs. Ruah. Questions or discussions on the motion?
If I may. No, I'm sorry.
Alexis, call the roll. If you're in favor of going to committee as a whole, vote yes. If you are not, vote no.
Mrs. Reed?
Yes.
Mrs. O'Connor?
Yes.
Mrs. Ruah?
Yes.
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 Mr. Bonavita?
Yes.
And Mayor Sepelli?
Yes.
7 yes.
7 yes, we are now in committee as a whole. Questions?
So
Discussion?
yes, I know you can't see me. I don't know how you're calling on people. I don't know if you want to go one person at a time. Just go up and down the row.
Go ahead, you have the floor. Go ahead.
Okay, thank you. Like everybody else, I've attended every questioning, listening session. I've read all the emails. I have received phone calls. I've had the conversations with parents. I've talked to a lot of different people. And it's in my opinion that we should have a combination of plans actually considered as a fourth option. The plan that the superintendent recommended, I would have no problem with it after a 30-day period of remote only. I think the school committee should have the power after the 30 days to come back and meet, statistically look at how things are going, both from COVID-19 standpoint and the educational standpoint, and then consider at that point in time going into the superintendent's phased-in program. But I think we should have remote, this is my thought process, of remote only for 30 days. And that which really is a combination. It's really part remote and it's part hybrid. That's my feeling. I've listened to a lot of people. I have read very detailed emails from all different sides, and that's the conclusion that I have come to be the safest way to handle this. This vote is probably the most important vote we have ever taken as a school committee, maybe in the history of the school committee. Because I don't remember any other prior pandemics that had the school committee voting on items. And obviously in my lifetime, this is really the first, what I would call pandemic, true pandemic, worldwide. So, and with the amount of deaths that have occurred and everything else, this is a life and death vote for teachers, for students, for parents. So I'm taking it very seriously, and I'd like to see a combination of first start out with remote. Now I know that the superintendent was looking at going with certain phase after certain periods of time. I'd like to slow that down a little bit by going 30 days remote. And let's see where COVID-19 is at that point in our own community and in the country. And let's see how the educational standpoint is working. I hear all sides of it, and what I'm trying to do is come up with a solution that protects lives. And I don't believe going directly into a policy where we go to the superintendent, and I thank her for all her work. She has worked tirelessly, and I give her a lot of credit. And I'm not really that upset with the plan she made. I would just like to see a delay of 30 days prior to that plan taking place. Now, I know there's time between now and when school starts. Yeah, that's some time. I'm talking about when school actually starts. And so I'd like to see a plan, 30 days, remote only, and then phased into the superintendent's plan. Thank you.
Thank you, Mr. Bonavita. Other comments, questions, concerns?
Yes, this is Carrie O'Connor.
Yes, Carrie?
Yes, so I have also, first I want to thank everyone, the administrators, the school committee members. We had reopening task force, teachers, students, parents, community. I as well have listened and read multiple emails and spoken to parents. We've all worked tirelessly, and the bottom line is our students need to be educated. However, what I think is in the best interest at this time, we do have, Agawam is considered one of the top 8 coronavirus hotspots. We are currently having testing in the town of Agawam this week, Wednesday and Thursday. There was some speculation about, a gathering that had occurred just a week ago. And my priority is the safety of our teachers and our students. For example, okay, if anyone has ever experienced a family member who had COVID, if you have not experienced that, we are putting our grandparents at risk. We are putting those with compromised immune systems at risk, and teenagers are getting this. Adolescents are getting COVID. I think that, the teachers, I'm listening to the teachers. The AEA put out a survey, and there was 190 educators that would prefer to start the year remote. And we have to listen to all sides. I also have listened to parents with community that are not in agreement with their children wearing masks in school. And that would give them an opportunity to have their children learn virtually. I have the special education population. I have a child who is special education in need. And what I did here is in that virtual plan that the district and the state will be working together to be able to accommodate those students. I think, but right now the state of Massachusetts numbers are spiking. We are having testing sites that are coming here. I called today. There's hundreds of people from out of town coming to get tested for COVID in Agawam. And the slots are full. For me, my priority is the safety and welfare of our teachers, our students, our administrators, and what concerns me is what are the protocols if there is a child or an adolescent or a teacher that has COVID in the school system? Are we going to keep that quiet? We can't do that. We have to ensure the safety and welfare of our students and our parents, and we have options for our students to learn at home if needed. I agree with Mr. Bonavita regarding, a virtual plan to phase into a hybrid contingent upon how our community and the results and the data that comes in. I feel the less transitions for our students, if our students start hybrid and then we have to shut our school down, that is another transition for our students. I know about social emotional needs of our students. I work in this field. There are ways to be able to work with the students. There are ways that we can support and accommodate our students in order for them to get a free and appropriate education. But the bottom line is, this is not a political issue. This should not be a political issue. This issue and concern, and the most number one priority, is to ensure that our community is safe. Now, I give the administration credit. We had strict guidelines that we had to follow. These plans had to be created across the Commonwealth. And Agawam, I give them credit because they've done a phenomenal job with these plans to submit to the state. However, safety and welfare comes first. I strongly believe that a phase-in from a virtual opportunity for our students would be the best option versus a hybrid, and we shut the schools down, and that is one more transition. So that is my, I want to thank everybody that has been working tirelessly over this. I'm listening to teachers. Teachers are concerned. The adults, if our teachers, what if a staff member gets it and it trickles down to 10, 15 other staff members? Then we will not have educators to be able to educate our students. Like I said, this should not be a political discussion. There has been a lot of political discussions within the community around this. And what is most important is what is in the best interest of our students and our community. Our students will be educated. But we do not want to risk lives of our students, our parents, our grandparents, our great-grandparents, and those with compromised immune systems. So that is my opinion. And again, I thank everyone who's participated. I've read numerous emails, parent, community, participate in the listening sessions. And this is a very difficult decision. But ultimately, my decision comes down to the safety and welfare of our community. With that, I'll pass.
Thank you. Let me just address some of those concerns, and I want Kathy an hour to do the same to verify what the latest is. But it was mentioned about testing in Agawam. I was called by the state 2 weeks ago, as was Kathleen, our health agent, and they wanted to know if they were interested in doing some free testing. Well, Agawam is a community that didn't have free testing in their pharmacies like some communities did. CVS did free testing, and other communities, Walgreens did. Agawam had none of that. So it sounded like a good idea. And at the time, I know that kids are going back to school, and it's my understanding that they have to have a negative test before they are allowed back on campus. So for a number of reasons, it was good for the community to have it. And if we do have people that are concerned, I want it to be convenient for them to have it here. And contrary to what everybody's saying about an uptick in Agawam and a large amount of cases in Agawam, there's an answer for that. First of all, there's not an uptick right now. As of last Friday, July 31st, we have 6 active cases. 3 were in the nursing home and 3 were in the community. To me, that's pretty low. We've had 522 cases since March, since it started, as of Friday. Of those cases, 522, 288 were in elderly healthcare long-term facilities. And I think that's significant. We have 8 of those facilities in Agawam. Other people don't. So when you take that number and you add that to the number of people in our community of 234, which to me is fairly low, average or below average, and that's the important number to me, because other communities, you're not comparing apples to apples unless other communities have 8 nursing homes and they do not. So, that being said, when you take our population, you divide that 522 into it, our per capita is high, and that's why it's ranked high at the state level. But that is very, very misleading. And I think the operative number, the number we should be focused on, is what we have for active cases. And right now, we're very low. So if we don't have kids back in school with 3 cases in the community, I don't know when we'll be able to. So I don't want people to be alarmed to think Agawam is crazy with COVID, because it is not. Kathy Howard, do you have our latest numbers? I know that was last Friday's number. Kathy, are you with us?
Yes, this is Kathy. So, as of today, we have about 10 cases. And some of those are still in our long-term care facilities.
So, active cases, there are 10, and half of those are in long care facilities?
3 of those are in long-term care facilities.
So there are 7. Thank you.
And I just want to add, I definitely see your point, Mrs. O'Connor, about a transition, but the start of a remote for 30 days and then into schools is a transition in and of itself. And it might be very difficult for younger students especially to start the year off in a remote plan. So I just kind of want to say, if that was kind of an option, that would happen transition. And again, we don't know if we would have to pivot back to the remote if we went to a hybrid to start. So.
Right. Like I said, I'm just, based on, I understand, Mr. Mayor, about the less cases in Agawam. However, I think, because of the testing sites, we might be seeing an increase, and also across the board. So that's my concern moving forward.
This is Mrs. Roa. A question directed back to Kathy Auer. Kathy, you and I spoke this morning and you gave me a different number. You told me 15 cases, so did that change between this morning and now?
So what happens is my public health nurse, Sherry Petrucci, who many of you know has years of experience, she is the sole contact for the MAVEN system that tracks all the cases that the public health nurses use. And I get a ding on my phone when a suspect case comes in, but when I left the office today, she told me there were 10 cases.
Okay, thank you. I'm a little confused how we lost 5 in the last few hours, but thank you. Am I allowed to continue to ask questions, or?
One second.
I was just going to ask Kathy if you could speak to the protocols that we have in schools that I believe Ms. O'Connor had asked about.
With a student.
With a student or staff becoming symptomatic or testing positive. I know the two of us have been collaborating with the state guidelines, but if you could just speak to that, I think people would be appreciative.
Yes. So if a student or a staff member were to become asymptomatic or test positive, only the people in that cohort would be required to begin quarantining. So if you've got a classroom with 10 people, only those 10 people. That's the whole purpose of the social distancing and the cohorting and keeping people in groups in certain areas and not traveling all around the school or intermixing groups. So those 10 people, say it's a group of 10 people, the staff and students, they would be required to quarantine until the test results came back from the person who was either symptomatic, or they would definitely be quarantining if a person tested positive. Now, I will tell you, there is some discrepancy right now, and we're working with the COVID Command Center to get this straightened out. If you're a community member and you are exposed, you automatically quarantine for 14 days, whether you test negative or not. What Desi has suggested is that if a person becomes symptomatic, they go out and they're tested, that if they have a negative test, they can return. And we don't necessarily agree with that. So we're hoping that becomes a consistent message before the beginning of school, because you can't have one group of people under one set of guidelines and another set of people following another set of guidelines. It would just cause confusion. You might potentially have people in the same household abiding by different guidances. So we're hoping to get that measured out. But I wanted to make it clear that it will only be the people in that class that would have to, remain home until the issue is resolved and the appropriate testing is taking place. There would be no need to shut down the entire school or even notify everyone. We are going to have cases. There's no doubt about that. There will be people that test positive throughout the school year. But, that I think we need to expect that. They may test positive whether they're in school or not. So that's something that we need to be prepared for. And, we've had several months of practice now with COVID. And as far as disease surveillance, that's something that our public health nurses have been doing for years. So I hope that answers your question. Thank you.
Questions, comments, concerns?
I have a couple of questions. Mrs. Shelley.
Go ahead, Mrs. Reed.
So I'm not going to ask about the virus. I'm going to ask about the plans. in the remote, and I know Shirley probably said this, I just want to make sure we have, people are listening and we have the facts straight. In the remote plan, how often do they see a teacher?
So if we are all remote, the entire district, they would see a teacher daily,
Daily.
online.
And you said something about the special ed kids, you said 1 to 3 times they would connect with it. You said something with the special ed kids and I didn't finish writing it.
Correct. We would attempt to connect with special education students on an individual basis, 1 to 3 times a week.
Okay, and if we chose a different plan, parents have the right to choose remote based on their situation, correct?
Correct.
And in the hybrid plan, with the high school, I know I went over this with you, they have 4 blocks instead of 7. Can you just go over that for the audience, please?
Sure. In the hybrid model at the high school, they are ready to modify their schedule to a 4-block semester schedule. So all teachers would be responsible for teaching 3 classes every day with no more than 20 students on their class list. But remember, in a hybrid model, that's approximately 10 students in front of them on any given day. The block schedule, the classes would be 75 minutes long. And again, they would have that class every day, Monday, so 2 days in person, 3 days remotely, until January, until the end of the first semester.
Okay, I'm sorry, go ahead.
I was going to say, that is our effort to minimize mixing as much as possible at the upper levels.
Okay, and is there any accommodation for the children that are taking AP classes?
So we
Which I know some teachers are concerned about.
Yeah, and I think there's concern across all levels and abilities of classes, to be honest. I know that there's concern for students who need extra supports, and then there's concern for students who need enrichment. And I understand that. I think that our hybrid and remote models are going to have to support these students in different ways. One of the ideas, especially for AP, because I know that's come up, is that Saturday sessions be sponsored throughout the year in order to kind of keep the content reviewed and relevant before taking the AP test.
Okay, and I have 2 more questions. Transportation, is that something we discuss later on in the year, or something you have to wait till we define a plan, figure out what plan we're going to use and then go from there, correct?
Well, yes, obviously, if a full-in model is suggested, transportation is a huge obstacle and challenge for us. With a hybrid, we don't know at this point, but then we at least will know what students will be coming in on different days, and we can start planning accordingly. And obviously, remotely, we don't have a transportation issue.
Okay, my last question, does going remote for 30 days affect our funding? Because I thought the superintendent, West Springfield, mentioned something about that.
It could. We don't know a lot about that, but it could. We also know that we will be getting assistance from the Department of Education if remote is our option to start. And I also want to say that it was brought up, and again, this a piece of information for you to process is if sports begin again, and that has not been decided yet, if the MIAA is ready to start with sports, even if it's at a limited list, schools who choose to open remotely will probably not be able to participate, is my understanding. Because if we are in a situation where we can't go to schools, it's probably the same situation that we wouldn't put kids playing sports together.
Interesting. So I have some things I want to...
Excuse me, Shelley. I have to interrupt for a minute because I know Attorney Dufour is on with us. He's been on since it started at 3, but he has to leave at 4:30. So
Okay.
I have to prioritize any legal questions for him because he has to jump off in about 10 minutes. He's been here sitting with us patiently, but that's my fault. I should push that forward. So is there any questions for Attorney Dufour before he has to leave us from anyone?
I do
Yeah,
not have...
I have a question.
Okay, Mr. Bonavita?
Yeah, I have a very simple question. Since there's 3 plans, that we have submitted to the state. Obviously, we're going to choose some plan ourselves, but we submitted 3. Does that relieve us from liability? Let's assume we go with a plan where students are in the school and the teacher gets sick. Is there any type of liability issues? I don't believe there is, but I want to hear from you and what your thoughts are.
Yeah, I would say what I've been telling clients is that you need to make reasonable decisions based on the data you have in front of you and in accordance with what the state is giving you for guidelines and the CDC. Okay. So as long as schools are doing that, which you are, you're presenting 3 plans that have been requested by the state, and you're going to choose one of those 3 plans to start the year. Every school system in the state is doing the same thing. I would say, is there a chance that there's a lawsuit about that? Certainly there is. But like any other case, I think as long as you're making reasonable decisions as a committee, I think that certainly limits liability. I think, 2, it's a very difficult case for anyone to prove one way or the other as far as where you got an illness, like COVID or the flu or any other illness. I think it would be extremely difficult as far as causation. And 3, school systems in the town would have liability insurance. It's something the administration could check to make sure it provides coverage for this type of thing. But in general, that coverage provides, you would be provided coverage in regard to most litigation under those policies. And I guess the last thing I would say is that committee members, under Massachusetts law, the case would be against the entity, which would be the town in this case. It wouldn't be, even if they named committee members, you'd either be indemnified or, in some cases, the court would remove you as a party and it would just be the town as a party. So that's kind of the framework in regard to litigation, but I would say, in my opinion, it would be, it would be a very difficult case for somebody to prove causation with that type of situation, with any illness like that.
Okay, thank you. I agree, but as an attorney, but I don't specialize in school law, so I wanted to hear it from you. So thank you very much.
Could I add one more thing though, just in case we run out of time here before I have to go? I'm just going to another reopening meeting after this. From what I heard earlier today from other superintendents, it did sound like the commissioner had said something about federal funding not being available, or his belief that funding might not be available from the federal government if a school chose to go full remote to open. I wasn't on that call, so I don't know if that's a correct interpretation of what he said or not, but that's what I've been told earlier today. And then I also did hear about the school aspect, that if you were full remote, not the school, the sports probably wouldn't be allowed if you were full remote to start. Not that those are, it's just additional information more than anything else.
Mm-hmm. Can I ask a question, Mr. Mayor? Is Mr. Wickstein online?
Yes, I believe he is.
Can I ask him if, how much money in our budget we receive from federal funds, approximately?
Mr. Klickstein, are you on the call? He may not be on the call, but,
Okay. Does the superintendent know by any chance?
So the federal funding through Chapter 70 is typically around $2 million of our budget, I believe.
That's
okay.
The federal funding that I was referring to is the additional monies that are supposed to come because of COVID in particular. I have no idea what that might be, but that was the message I heard this morning, is that those additional monies might not come in. And there could be a substantial amount of money, but I have no idea.
I received 2 installments of CARES money already, I think 800 and 600,000 just to the schools. So it's millions.
Okay, thank you.
I have a question for Sheila.
Any more questions for Mr. Dupre, because he's going to be jumping off? Any more legal questions? Shelley, are you good? You had a question, a legal question, or are you good?
No, I'm good. Thank you, Mr. Dupree, for coming to the meeting.
Okay. Mr. Minio, I'm sorry, go ahead, please.
Sheila, I just want to clarify, sort of for everyone, that students will have the ability to start with remote, and if they do feel comfortable later on, they do have the option to jump into whatever model that we do decide.
That's a very good point, and we're finalizing some of those details. The answer is yes, and we're actually thinking about perhaps like a 2-week trial period, whereas they can change their mind if they chose remote and want to come back to school, or vice versa, have started in school, if that was how we started, and wanted to go remote. And then our discussion is probably a longer period of time before they could change again. Just so we can keep track of what students are in, which students are out, make sure that we place them appropriately, we provide the right services, and also to minimize mixing and remixing over and over.
Okay, and then another question that I did have is, on Wednesday, will we be doing a deep cleaning? Will there be any special cleaning that'll take place either on Wednesday or either over the weekend than the normal cleaning that happens every day, let's say?
So right now, our normal cleaning every day is a different and special cleaning than before COVID. So our custodians are doing a cleaning, disinfecting every day, at the end of each day. On Wednesday and Thursday, they will be making sure that they sanitize high touch points areas like I had mentioned before. So they will be doing their work differently during the day. On Wednesdays, there will be an opportunity to do some of the larger areas, some of the floors, so it might not necessarily be different, but it will be, they will have the opportunity to do more cleaning.
Thank you. I did also just want to say, at least for the public that's watching, I did tour the schools today. I did, talk to all the principals, at least most of them directly. A vote for full in would put them in a very hard position. Multiple children eating in multiple locations, feasibility as far as release times and pickup times and needing police assistance or kids eating on the ground at an auditorium for lunch. So I think, based on that parent survey that we did get, although I don't believe it's quite 81% as far as the parents that want kids to return full time, I don't think that they 100% realize in order to meet the standards that are set, the type of hardship you would put the schools in for that type of vote. So I just wanted to clarify that, because it is 3 options, and we seem to only be talking about 2 of them. So I sort of wanted to just, touch upon that specific one. Thank you.
Yes.
And I just want to clarify, Carmen, you bring up that survey question. The question was worded, under guidelines, would you send your child back to school? It did not specify full-time or hybrid or anything else. So I just wanted to be clear that that's how the wording was for that question.
Thank you.
Hi, it's Wendy again. For Wes, before you are gone, you talked once before about the mask policy. When we address that, what do we do with our non-conforming, that whether it's because they're just saying, I'm going to take off my mask in class because I feel like it, and also if we have legitimate reasons why there's a student group that cannot wear those masks, how do we put them into our schools and not have them sitting next to a student who is wearing a mask? Like, how do we do that? Is there any legal points to those questions?
So, administration has been working on a policy, actually, which we reviewed and added some language to it. So I think that policy will probably be going to you. It's really more of a process, really, but that should be going to you soon. But generally what schools are doing is, if you have a medical reason, obviously we accommodate. So that could mean more PPE, it could mean different types of separation. We might have plexiglass, or we might have face shields in addition to a mask. There's a whole, for other people in the class. So a whole bunch of things we could do, and I think schools are still talking to boards of health about exactly what to do that would be safest. But that would be what you do with a medical situation. So they'd still be able to go to school. We might request that people decide to do remote in that case, but that's really a parent and student decision. It's not something we would force on somebody. If somebody's just choosing not to wear a mask with no medical basis behind it, then usually you follow the student handbook as far as, the process we'd use to try and get the kid to start wearing a mask. But the child would usually be removed from the room in the meantime so we could figure out what to do next, because you have to balance people's rights to, not wear a mask versus the health risk. And so right now, the health risk, in my opinion, would outweigh the right to not wear a mask. There might be some point in the future where COVID is no longer really an issue, and that could change things, that balance. But right now, I would say that's where we're at.
Okay. Thank you.
I just want to add that language is on page 14 and 15 of the plan. We did add that into our reopening plan.
Could I ask a follow-up? I need to jump off this call, but I wanted to ask one more thing, Sheila. I know, to go back to Carm's question, the remote plan, I know some school systems, if you choose full remote through the state's curriculum program, whatever they're coming up with, some places are saying you actually have to stay in that program for the semester at least, because of the way it's set up and the fact that it might be hard to go from working with Agawam teachers and their pace and their curriculum to going to something totally different, and it might be hard to go back and forth. I don't know if you're even looking at the state program, but that would be another question, I think.
We haven't seen the state program yet. We are thinking about that for especially upper levels, but we don't have that information. We've had conversations, and we feel, and again, we're kind of basing it on something we haven't seen yet, but we do feel we want to offer a little bit more flexibility to our families in Agawam. We were talking more about a term instead of a semester.
Sure. Okay, well, thank you, everybody. Have a good night. And if you have any other questions for me, I'll be on this other call, but you could try texting me, and I can try to answer that. Okay, thank you.
Thank you.
I do have
Mrs. Hoffman, can we go back to how you address it? Do you see on page 14? But it doesn't say what what we would do with the kids without a mask, so that is still to come?
Yes, that would be under student handbook and administration.
All right, so we just don't know yet.
Let me just go back to Carm for a minute. I think he got interrupted by Russ, who had to jump off the call. Carm, were you done?
Will we be discussing this again prior to this vote? Like, we'll be able to touch upon why we're voting a certain way? I just want to make sure that, I know we're in committee as a whole, which we don't often go into, but I just want to make sure that, I understand the format of how we're going to be doing this.
When we come out of committee as a whole, I will, the questions are being asked now, the majority of them, and people can make comments, concerns, anything they want during this. I could go back and ask for any questions or comments, but it would be repetitive. I would think we could make our statements now while we're in this particular session, so that when we do come out of this, I would hope we had all our questions, concerns, comments addressed, and then we would take the vote at that point.
Okay, thank you.
Okay, so what I will do is I will go through the roster after everybody seems to have all their questions and give people a chance maybe to make any comments they want now. And then I will go and ask for somebody to make a recommendation for one of the three and to get a second and individually take those votes independently based on how you want to handle it, who wants to make a motion. Does that make sense?
That makes sense.
Okay. Wendy, go ahead, you were speaking.
Thank you. So I do have a few questions. First one, please, for Kathy Auer. When it comes to, and I guess Mrs. Hoffman too, so I heard you say that we would notify if there was indeed a positive. In the language, it seems to suggest that if you sit 6 feet away and you're masked, that you don't need to be notified. So if there's a positive test in class, and someone, whether it's Kathy or Mrs. Hoffman, could someone please explain who would be notified if a positive case is confirmed in a classroom?
Yes, I'm here. I'm here. So the usual route for contact tracing, when we're notified by the state laboratory that a positive test has come in, we contact that person, and if it's a minor, obviously we deal with the parent, and we make a list of all the people they've been in contact with. In a school setting, because that's also a workplace, they would have to, the teacher would be notified, the teacher would notify the superintendent, and it would have to go up that chain of command, and then, they would make a decision, hopefully in collaboration with us, about who exactly was exposed. If the student or the staff member that was positive was only in, say, classroom A in this common area, then only the people that were within 6 feet of that person more than 15 minutes would be considered an exposure.
I have a Carrie O'Connor. I'm sorry when you're done.
Mrs. O'Connor, can I keep on my line of questioning? Is that okay? So, Mrs. Auer, so if that would almost mean nobody would get notified in a classroom setting because they really should have their mask on, be 6 feet apart, and never be 10 to 15 minutes without that situation occurring. So if there was indeed a positive case, does that mean no one is going to be notified?
No, everybody in that cohorted group, if it's in an indoor space like that, they would be considered a risk for exposure. So quarantining is a precaution. It's not saying you're definitely going to get it. Quarantining is a precaution. And as we all know, unless you're a medically trained person with a medical grade mask, there still is some risk. So anybody in that cohort in a closed space like that would be considered close contact.
Okay, that's
so they would all be notified.
Okay, that makes me feel a lot better. And are you the point person that the schools deal with when they talk about this COVID point person? Are they connecting with you?
Well, the superintendent most likely would notify me. But at that point, we would already have been notified by the state that there's a positive case, and we would have already begun the contact tracing.
Okay. Mrs. Hoffman, can we go back to the remote days during hybrid?
Sure.
Well, the days that the cohort is at home during hybrid. Who is doing the instructing, and where do those lessons come from?
So all students will be on the class roster in a class, and that class roster and class work will live virtually. So if I'm a teacher in third grade, I have 20 students, let's say I have 18 students on my class list, 9 of them will be in front of me Mondays and Tuesdays, 9 might be Thursday, Friday, it could be 7 and 11, something like that mix. And so they're all in my class. I'm providing direct instruction to them when they're in front of me, but I'm also working with a group of teachers in my little, it's almost like a cohort of teachers too who are responsible for that class, who will be assisting with maybe posting something remotely, posting something online for the remote students to do. I envision and I hope, and we're planning some PD around this, is students are collaborating while they're remotely too. So we want projects and assignments and papers to have a process where, like, again, if I write a 2 paragraphs for my assignment, 2 other people are editing it for me online while we're home. Some of that real collaboration, communication, skill-based work is being done remotely. And
remote hybrid home days, you're learning, but it is content that maybe it's a project or it's collaborative, but there's not direct teacher instruction. But if it was all remote, there is actual instruction every day, you did say?
Yes.
And that was coming from Agawam, or we're not sure if it was all remote, if that would be an outside platform, if a student opted in?
I would say at this point, we would not do another platform for younger grades because we think it would be too hard for them to manage. but we are considering it for upper grades. And by upper grades, I mean possibly 7 through 12.
So if an 11th grader who is immunocompromised opted to take the remote learning for this year, they may learn on a totally different platform.
Correct.
Okay. Thank you. Also, I think ventilation's been answered. I guess I want to give my sort of story of where I'm at with all of this. So this morning we had an email inviting us to a tour that had been rescheduled to come and meet with the principals and to tour the buildings. And when I got that email, I'm not going to lie, I started to get ready to get dressed, and then I realized I was anxious. I was anxious because I started to think, what if someone's sick around me? I was anxious because I thought, what if someone isn't wearing a mask? I was anxious because I thought of the what ifs, and there were a lot of what ifs that made me want to stay home. And then all of a sudden I thought of myself, if I was a teacher, every day I'm going to wake up and have those what ifs and think, can I do this today? And it caused me some actual anxiety before I left the building. I decided to go take the tour because I felt it was really important to sit in a teacher's, to see what we're about to vote on. Because as others have said, this is monumental. We've had over 250 emails. We have talked to people at length. We've really, really done our homework. I know I have. So then I got to the Deering School, and I'm going to use that as my example. I was there for about 45 minutes. And there was, I decided to kind of I was hearing all the questions. I was feeling really sweaty and hot. I'm not going to lie there either. It's about 73 degrees today, so not very, very hot out. Yet the inside was very humid. As I was asking so many questions, my mask was actually getting kind of wet and gross. And then as I started to think about where I would have to sit and ask the questions, I was realizing I'd have to sit in the same desk all day, be facing forward. So there was a teacher that was setting up her classroom, and I just kind of wandered in, and I stood in the back of the room, and I sat there. And I sat there for a little while, and I raised my hand and said, can I ask you some questions to her? I said, do I have to sit in this desk all day? She said, you do. I said, you're going to teach from your block in the front of the room. She said, I am.
She lost power. She might not know it though.
I think everybody did.
Everyone's frozen, Stephen. Dawn's live. Dawn's not frozen. Yep, Dawn.
Hi, Dawn.
Oh.
I'm not frozen.
I am back. Our power is out. Our whole home, our power is now out. Can you hear me?
Yeah.
Okay. I switched to my laptop, but our power at our house is out.
Yeah, hold on 1 minute because we're dealing with our IT gentleman here, and I think power's out because, Tom, you're not in, are you?
Wendy. Okay.
Anthony, are you still on?
Yes, but I did suffer a bit of a power outage and then it came back on.
Okay, Don, you're on, correct? So we have Don, Anthony, and Wendy, I think, only. Shelley, are you on?
I'm here.
Shelley's on. Carrie, are you on?
I am.
Oh, Carrie's on, okay.
No, I'm here.
Tom, are you on? I think Tom's trying to dial back in. So we have Shelley, we have Carrie, we have Wendy. We have Carm, no? We have Anthony?
Yeah, I'm here.
Don. Okay, let's wait a minute before we can get Carm hopefully back in.
120 people just left the dog.
Yeah, that big gust of wind probably took some power lines down that we just had a minute or two ago. Let me text Carm and see if I can find out something here. Yeah. Give me a second, I just text Carmen.
Wendy, are you able to be back through your phone?
I had my laptop ready to go in case this happened.
I see, okay.
So you're on battery power.
I'm on battery power.
Karen, are you on regular power?
I have power, but I can't get on, so I'm just on the phone.
That's okay, good enough. I can't do that on Friday. Yeah. Everyone, I want input from all of you. Looking at the power outage and Carmen in here, but even if he gets back, we have several parents and staff that can't tune into the meeting now that must have lost power as well. My thought is we can call for a Monday meeting to complete our discussion and our subsequent vote. Does that make sense to everyone?
I'm sorry, I didn't hear you. Could you repeat that?
What I'm looking to do, can everyone hear me?
Yeah, now I can.
Yeah,
My thought is that we adjourn our meeting presently where we are. We pick it up on Monday. We repost for a meeting on Monday. But we have to have a decision by Tuesday, or not by Monday.
by Monday.
By Monday.
Morning? When did you want to?
Oh, I don't know.
Real sentence.